Hello and welcome back to Chapter 12, talking about home health care. We're going to pick up with information management on 463. So coding our classification systems include diagnosis, procedural, and if the primary physician chooses to bill Medicare for certification, recertification, and or plan oversight, physician procedural codes. Diagnosis and procedure codes for the home health agency are classified using the current modification of ICD, and the physician procedural codes are classified using CPT. All right, so I'm not going to get into all of this, but you can read under ICD and again read under CPT over on page 466 going into 467. So be sure to read through that. All right, so we're going to pick up with data and information flow. Data collection generally begins upon referral of the patient to home care. During the initial and subsequent home visits, home care staff members collect data using paper-based systems or computer-based systems that utilize laptop or handheld computers. Data are transmitted to the home care agency's office by manual or electronic means. When the patient is discharged from home care, the complete record is maintained in a central location in either paper or electronic format. In your electronic information systems, we're going to discuss that next. Some agencies use their own homegrown systems and others use systems from various healthcare information system vendors. Information system vendors specializing in home care systems typically offer the ability to manage information concerning referral, census, OASIS reporting, medication profiles, orders, scheduling, Medicare certification and recertification, progress and visit notes, and other data and documentation. The use of an electronic health record system has been increasing steadily in home health. And according to a study published in the Journal of the American Medical Informatics Association, about 40% of agencies providing home health services were using an EHR in 2007. This study also showed that more than 20% of home health providers were using some form of telemedicine. Because of the distances involved in rendering services to home health patients, the advantage of electronic systems are obvious. All right, so let's talk about data sets. So we know our data set in home health is OASIS. The OASIS data elements were developed, tested, and refined over a 10-year period through an extensive research and demonstration program funded by CMS. The Center for Health Services Research in Denver, Colorado developed the OASIS and maintains its copyright but permits the free use of OASIS. The extensive data set is approximately 25 pages when printed. All right, moving on to quality improvement. Outcome measures are the heart of the outcome-based quality improvement and outcome-based quality management. These are systematic approaches that home health agencies use to continuously manage and improve the quality of care they provide. Home health agencies are able to access reports on outcomes for their patients through their state agency and thus compare their results to the national reference. Dropping down to that last paragraph on that page. Although the process of gathering, encoding, and submitting the OASIS C1 data may seem to be an end in itself, it is merely the means to achieve outcome measurement and only the beginning of the process. OBQI and OBQM is fundamentally a two-stage process. First, the data must be gathered in a uniform manner through your OASIS C1. This results in a report showing the agency's performance in terms of outcomes relative to the national sample. During this first step, risk adjustment occurs through grouping or statistical methods to compensate for the potential influence of case mix variables that can affect outcomes. Risk adjustment is done by the state agency for some data elements. Reports may be printed with and or without the risk adjustment. In the second step, the agency selects target outcomes for enhancement, evaluates care for the target outcome, develops a plan of action to change the care, and finally monitors the outcome to see if the desired gains have been accomplished. And moving on to utilization management, but in the slides, on slide 28 and on page 469, you actually have an example of the two-stage outcome-based quality improvement framework. So you have your outcome analysis and then you have your outcome enhancement. So it's just one big process over and over again. So be sure to know that, that figure 12-4. All right, moving over to utilization management. Utilization management focuses on monitoring the increase and decrease in the utilization of services provided to patients. Utilization management seeks to assure that services are appropriate to the patient's conditions. For example, a patient may be receiving skilled nursing services for a terminal disease. Offering social and mental health services to such a patient is typical for proper utilization. A home care agency may have separate written plans for quality improvement and utilization management. The plans that seem to produce the best results combine the efforts of all information-based areas: quality improvement, utilization management, risk management, information management systems, and finance. HIM professionals are increasingly and successfully taking on quality improvement and utilization management duties and roles using their clinical knowledge and ability to develop tools and reports from large repositories of clinical data. All right, drop into risk management and legal issues. In general terms, risk management is a program that monitors the liability and accountability of home care services delivered to customers. The areas at risk are measured through clinical analysis by way of incident reporting and financial analysis through the agency's insurance policy. Typically, the health information manager manages the incident reporting to minimize the risk of injury to patients, visitors, and employees, and to delineate procedures for reporting and follow-up of incidents. An incident or unusual occurrence is defined as any happening that is not consistent with the routine operations of the agency or the routine care of a specific patient. And then we have some key elements of the procedure for reporting incidents on page 471, so be sure to read through those. There's things such as establishing timelines for reporting and evaluating the current occurrences, recording the facts. Do not maintain incident reports with the medical record, which we've talked about this in law. However, the chart should be documented regarding the occurrence, reflecting the continuation of treatment provided to the patient. And then, sharing the reports with appropriate committees. So be sure to read through those steps on 471. Another form of proactive risk management is to utilize a satisfaction committee to monitor customer satisfaction issues. During the initial visit, all patients and caregivers should be informed and presented with a patient bill of rights, which includes the toll-free State Department of Health hotline number and the agency's contact number if there's a problem. This allows patients and caregivers to express concerns and grievances regarding patient care. The committee should monitor issues for all customers, including patients and their caregivers, physicians, and insurance companies, and try to resolve them in a timely manner while maintaining continuity of care for patients. Our legal issues involved in all departments of home care and are handled best if done proactively. The Human Resources Department is legally required to have certain information on file for new employees. Following is a general list of items to complete when hiring new employees. You need to know their past employment, including dates, employer, salary, and work performance, their education, and if they're licensed in a particular profession, criminal background check, a state driver's license, a credit check for finance employees, and then the most common requirements for licensed professionals in most states are as follows on 472. They have to have CPR. Each person should be recertified once every 2 years. OSHA, they should have in-service educational programs that are used to provide a safe work environment for employees. Topics include ergonomics, first aid, bloodborne pathogens. And OSHA in-service programs are usually presented annually. Universal precautions should be practiced at all times. Safety in the community should be practiced at all times. And the Joint Commission requires the original license of all professional staff members to be a part of their personnel file. And then other common in-services required by home care employees include training pertaining to body mechanics is required and usually completed annually. And then confidentiality in-service instruction is required at the time of hire and recommended to be done annually as well. Health Information Manager ordinarily develops or at least updates policies related to medical record procedures. Following his recommended list of certain policies for review and approval by the agency's legal counsel: advanced directives, release of medical information, general treatment, alcohol and drug treatment, HIV/AIDS treatment, mental health information, procedure for responding to subpoena and court orders, and procedure for do not resuscitate orders. All All right, moving over to 474 for our last section, talking about the role of the HIM manager. HIM positions within home care are still considered non-traditional. However, this career path is becoming more common for recent graduates. The role can be highly rewarding because it usually extends beyond medical records. HIM home care positions require knowledge of finance, quality improvement, utilization review, and information systems. Now more than ever, to survive and thrive in the data-driven world of home care, agencies must make good use of the information available to them. Health information managers can play a key role in developing, implementing, and maintaining effective information systems for home care. Becoming familiar with the home care market and how to be competitive within that market provides HIM professionals with another arena in which to demonstrate their skills in managing information and making the information useful. So again, read through this entire chapter, get familiar with the home health care. So good luck and happy reading and happy studying.